Hello everyone, welcome back to Medical Coding Club. Today I'll be discussing the remaining conventions coding guidelines for ICD-10. So let's begin. So the first two convention is and or. So this one, if you see in ICD-10 coding, the word and is interpreted to mean and or. Okay, so it means it allows the flexibility in describing the multiple conditions. So for example, as you see here, tuberculosis of bones and joint, if you go to that subcategory, you will have the codes. Uh, you can use the code for tuberculosis affecting bones as well tuberculosis affecting joints. And if both come together, we will be assigning both together. Okay, so always and interpreted as or. Okay, so next term is with. So the term with in the code description or alphabetic index, it indicates the link between two conditions. So the meaning that they are related and should be coded together. So for example, E11.22, that is type 2 diabetes mellitus with chronic kidney disease. So here there is a causal relationship between diabetes and kidney disease. So we can assume and we can code together unless the doctor says otherwise. That means if doctor is not documenting anything, we can assume the causal relationship and we can build the combination code. But if doctor is specifying that they were not related to each other, kidney disease was because of something else. So if the doctor specifies that particular reason other than diabetes, then we cannot code this together. Okay, so this is the meaning of with. Next we have C and C also. So it is very important to know the difference between C and C also, because generally we will be using or we will be regularly seeing these terms. So the meaning of C is you are required to look at another main term to find the appropriate code. So the example, if you see, if you look up to flu in the index, it might direct you to influenza. So here flu is not a main term. So if you cannot lead the code, appropriate code from the flu section. So instead what we have to do, we have to go to influenza term and we can take the appropriate code from there. Okay, so that is the meaning of C. Next, coming to C also. So you are encouraged but not required to check another main term. So this is like for confirmation. So see here, C also. If you search infection, the index might suggest you also check sepsis if the infection has become severe. So if the provider has not documented anything related to sepsis, you don't have to code for sepsis. But only infection is documented, we will just code for infection. But here they are saying if needed, if infection become more severe and if the provider is documenting like sepsis, then we have to take code from the sepsis area. Okay, so that is the meaning of C and C also. Next we have code also. So the explanation of code also, instruction tells you that more than one code might be necessary to fully describe the condition. And here example, if you see, there is a pressure ulcer of right hip stage 3, and here you can see code also it might suggest adding the organism code. So in the documentation, if you see like there is a staphylococcus infection, okay, so then we have to assign the code for the organism also, so that we will have the condition and the root cause together. So now we will have the we can describe the condition in a better way. Okay, so this is the meaning of code also. Next we have default code. So the explanation of default code is the one listed next to the main term in the index and represent the most common form of the condition or the unspecified version when no details are provided. So in the documentation they are only specifying pneumonia. Okay, that they are not specify the type of pneumonia. So what we will do, we will go with the pneumonia default code, which is J18.9, pneumonia unspecified organism. So next, code assignment and clinical criteria. So here diagnosis coding is based on provider diagnostic statement that the condition exists. So the ICD-10 CM guidelines state that you should code based on the diagnosis provided, even if clinical criteria test results are not documented. So sometime provider may, like, he will not perform any test, but he will be saying like COVID positive. So COVID positive, at that time I have to assign the positive code because it purely depends on the provider statement. So as he is confident and he is saying diagnose, like he is diagnosing it as a COVID positive, we cannot ask for anything else. Suppose if provider has diagnosed COVID positive and he has performed the lab but he has not given the result. Okay, so at that time we can query that results are not yet documented. Okay, so example here, one more example, that is acute bronchitis. You can assign the code J20.9 acute bronchitis unspecified without needing any additional test result or lab values. Okay, so it purely depends on the provider diagnostic statement that a condition exists. Next, use of signs, symptoms, and unspecified code. So here mainly signs and symptoms. So if definitive diagnosis is not available, so some conditions are not there, single condition also not exist in the document, then it is acceptable to assign the symptoms, or we can utilize the default codes or unspecified codes, but only if it is necessary. Okay, so the first priority would be we are going with the symptoms which are documented. So example, patient present with a chest pain but no specific cause identified yet. Okay, so in the current visit there is no conditions exist. So what we are doing, we are going to code chest pain unspecified for the temporary purpose. Maybe in future if the patient come back for the same reason, they might do diagnostic and then they find out, then they can find the condition. But as of now we will be going with the symptom. So these are all the remaining conventions from ICD-10 CM coding guidelines. And thank you for watching. Please do subscribe to my channel and please do follow me on Instagram. And if you are following me on Instagram, then you might get the updates when I take webinar and everything. If you are not following, please go back and follow my Instagram. And as I said, please do share with your medical coding friends. Thank you all.